Nurses, if anyone's not with a patient right now, if you could all come to the conference room for a quick in-service, that would be super great. Thank you guys so much for taking time out of your schedule to come to this in-service. I know you're all very busy, but we're trialing a new program here on our unit. That's why we have Kirsten here. And she will be taking on the role of a pediatric palliative care nurse specialist here. So we're just gonna start initiation of the role coming up in the next few weeks. So we wanted to introduce you to what she's gonna do. This is fairly informal, like most in-services that we have are, so feel free to ask any questions you guys might have.
Hi guys, my name is Kirsten and I'm gonna be a pediatric palliative nurse specialist on this unit. So I'm just gonna tell you a bit about my role and how we as a team are gonna integrate palliative care on this unit. So I'll be here from 9 to 5 Monday through Friday, and I'll be introducing myself to every new patient with a new cancer diagnosis receiving inpatient treatment. The initial introduction will include a meeting with the primary caregiver, whether that be a parent, grandparent, whoever, depending on the situation, and the patient if appropriate, like by age or severity of the disease, stuff like that. And then after the initial visit, I'll be still working with the same patients and their families throughout their inpatient stays, just to kind of help coordinate and streamline care between the different palliative care teams, as well as the surgery teams and the oncological teams, things like that. So, and it's just really to maximize their quality of life and minimize their pain as much as appropriate. And I serve as an advocate for palliative care, which minimizes the need for you guys to take time out of your busy day to help try to coordinate the care between all the different teams and everything going on. Do you have any immediate questions, or should I keep going?
Yeah, so I have a question. So these are my patients, and I really don't need another party coming in, giving their advice and just stepping in, because in my opinion, I provide great care on my own. I've been doing this for decades.
Yeah, that's a really great point, and I know that all of you guys are really competent at what you do. I'm just really here as a resource for you and your patients to utilize. Research has found that palliative care has the most success and benefit to patients and their families when implemented at diagnosis rather than later on in treatment. And so my role mitigates exactly what you're mentioning, the tricky issue of introducing new care providers like halfway through or at the end of treatment when trust has already been established between the primary caregivers and the regular team that they've been seeing the whole time. Does that kind of help answer your question?
Sort of. So basically what you're saying is that you'll be working with the patient and family from the beginning of their care, like how I've been doing, not just randomly stepping in occasionally here and there.
Mm-hmm. Yeah, exactly. I really don't want to step on your toes after that, so don't worry about it. The hope is that by being integrated from the beginning, you and I can really work together and know the patient as best as possible, as well as their needs and their family needs and their wishes for care as their disease progresses or gets better. So at the end of the day, this is all just so that the patient has the best control over their care and their treatment.
You mentioned research. Can you provide a little more information about that?
Yeah, of course. I really appreciate you bringing that up. Just in case there's any confusion for anyone, palliative care is not end of life or hospice care. It's more of a holistic care of the child's mind, body, and spirit. So it's really important to differentiate the two. I think there's a lot of misconception about that. Palliative care mostly focuses on quality of life, and it's for a child with any life-changing condition, not just a terminal disease. So to that end, research has found that clinical staff, which includes us, develop a caring and trusting relationship with the patient from the minute of diagnosis, and new care providers are typically not trusted in the same way by family and the patient later on during treatment. So this diagnosis period is the most crucial and important when it comes to getting palliative care involved. And it benefits nursing because then everyone can be on the same page from the beginning. There's not as much confusion between the different teams, between nursing and PT and the oncological team, the surgical team, everything like that. So it's more about having the same goals for the whole team overall and working with the patient and what they want, just to make their quality of life as good as it can be. Just in terms of like, if it makes them sicker, the treatment, we want to make sure that we're mitigating that treatment as much as possible. Minimizing their pain, not maximizing. Oh my God, I would probably get fired if I said that at a conference, so glad we're not there. But yeah, so just that's more of the research side, just integrating my role, hopefully as early as possible, will help the child as much as possible.
All right, Kirsten made a lot of really great points there. I'm sure you guys as nurses on the floor can all think of a time where you've had a patient who was in the thick of treatment and disease progression, and care goals became unclear. There wasn't an established plan. Not all components of their care was thought about. Maybe they were in a lot of pain and you didn't fully know what to do about that or how to treat that in the best way possible. So I hope you can see how Kirsten being here will help kind of fit into the treatment plan and make that go a little smoother for all of our patients on the floor. So if everyone could take a second to thank Kirsten for being here, and I'm sure we'll be seeing her around the unit soon. Great, thanks.
Thank you.
Come in.
Hi. Hi, Lily and Helen.
Hi.
Good.
All right.
So I brought Kirsten here with me. She's our pediatric palliative care nurse specialist on the floor. And yeah, she just wants to introduce herself and kind of explain what her role is. Is now a good time to talk?
Yeah,
Okay.
yeah, sure. So you said you're a pediatric,
Palliative care nurse specialist.
Oh,
So
okay.
kind of a jumble of words. Sorry about that. I didn't get to pick the title. So yeah, my name's Kirsten, and I'm trialing a new type of role on this floor where I'll be working as a pediatric palliative care nurse specialist. So my job is to meet with every patient and their family upon admitting diagnosis for a new oncological disorder. So I'm here to work with you, the patient, as well as you, the family member, throughout your stay to help coordinate team care and maximize quality of life while minimizing pain.
okay. Wait, palliative care? Does that mean I'm dying, Mom?
No, honey. Right.
Yeah, no,
Okay.
don't worry about it. So no, my involvement has nothing to do with death. Research has found that when palliative care is implemented at diagnosis, it has more benefits to the patient than when it's implemented later on. So we're trying to get ourselves involved as early as possible. And palliative care isn't synonymous with hospice care, which is what a lot of people think and is a misconception of it. So my job is more focusing on quality of life and minimizing pain long before end of life becomes even a topic of discussion, if it ever becomes one. So I'm here to support you and your family throughout this whole process, and I brought a packet with me that you can kind of take a look at and hopefully get some more information on me and my role, and I'll be checking in periodically as well.
Yeah, that sounds great. Thank you.
You're welcome.
I'll take it back to my family and we can all look over it together.
Sounds good.
So does that mean that I'll be able to go to the playroom more often?
Yeah, so remember last week when you first came in and you were feeling really sick? My job is to kind of help you get to where you are now so that you can have time in the playroom, go play with your friends, interact with a lot of other people, but not be so sedated with pain medication that you're just in bed all day. So the goal is to kind of have a balance between pain management and also quality of life.
That sounds like good, right?
Yeah.
So how often are you here?
So I'm here Monday through Friday, 9 to 5, but I'll be checking in every day that I'm here just to kind of see how things are going, help facilitate the relationship between you guys and the many different people around here. So I'm kind of a constant face that you'll be seeing. But I also have a business card that I can give you. Just if you have any questions, you can email me, call me at any time. I'm pretty responsive now that we have iPhones and everything, you know, I'm constantly online at work when I'm not at work, you know. So just if you have any questions or anything, I'll be around every Monday through Friday. So also if your other family members have any other questions, I'll be here all the time pretty much. So there's definitely opportunity for them to ask me questions as well.
Okay. Thank you. That sounds really good. Sounds good.
Really nice to meet you guys.
It's nice to meet you too.
You too. Thanks, Kirsten.
You're welcome.
So now Yeah, that's a lot of information. Probably just thrown out at you all at once.
Yeah.
Do you have any questions?
Well, it really was a lot. Like, there's a lot of information in there, but it sounds like we could really benefit from this. What do you think, sweetie?
Yeah, I'm just glad that I'm not dying.
So I'm really glad she made that distinction between palliative care and hospice care. I think it's really important to make that distinction. I know that word palliative care can be scary. But basically Kirsten is gonna be, like she said, she's gonna be constantly with you guys, constantly checking in. At rounds, she's gonna be there too, with the doctor, the nurse practitioner, social work, et cetera, et cetera. And basically her role is to help coordinate that holistic care for you guys. And she just wants to make sure the team's functioning effectively, and her main priority is your quality of life and your pain management, which is, I'm sure, the most important things for you guys, right? And she's going to connect Lily with music and art therapy, child life services, and other programs that the hospital offers that are designed to enhance Lily's quality of life during, what must be such a hard time for you guys. Do you have any other questions that may?
You know what? I think we're good right now. We're just gonna sit on this, and I'll look over the packet with my family. But I'll come back with any questions I might have for you guys. Okay?
Lovely. Don't be afraid to reach out. But I'll be back in a couple minutes to give you your meds.
Great.
Can I grab you anything before I go?
I think I'm good. Thanks,
Okay.
Esther.
All right, I'll be back.